I'm Jue Deng, a biostatistician from the University of Pittsburgh School of Nursing. I'm really glad to have the opportunity to present at our Medicine 2025 today. And before we jump in, I want to quickly mention that the survey I'll be talking about, originally called the Social Determinants of Health Survey, or SDOH survey, has been renamed as the Social Factors of Health Survey recently. But to stay consistent with our R package and the user guide we built on, I'll still use the term SDOH in this talk. Today, I'll walk you through AOUSDOH tools, an R package we developed to make it easier to work with this survey data inside the Of Us Researcher Workbench. Let's start with a bit of background. So, Of Us Research Program is a major NIH initiative aiming to gather data from over 1 million people across the US. It includes not just health records and lab results, but also wearable data, biospecimens, and surveys. And a big focus of the program is health equity, like enrolling participants who've historically been left out of research. That's amazing, but it also means the data is big, diverse, and complicated. So here's the issue. The SDOH survey collects detailed information on things like housing, education, stress, social support, all these factors that affect health but aren't clinical. That's great, but the raw data is so messy. It's spread across many rows per person, there's no built-in scoring system, and if you want to use these variables for modeling, you need to clean and compute everything manually. We ran into these challenges ourselves and realized there should be a better way. So we built this package to take care of that, clean, consistent, and reproducible. So AOUSDOhTools is an R package designed specifically for working with Of Us SDOH survey data. It automates the entire process of recording, scoring, and outputting clean, person-level variables you can use in your analysis. We based it directly on the published user guide by Dr. Kolik in JAMIA in 2024, which outlines literature-informed scoring logic across protein constructs. And I have to say, it also comes with a very cute hack sticker, in case you're a sticker person like me. So the symbols in this sticker represent housing, education, food, and income. They're key components of social determinants of health. So basically, you plug in your raw survey data and get back ready to use SDOH scores. We included 30 functions for scoring 14 constructs across SDOH domains. Things like neighborhood cohesion, neighborhood disorder, food insecurity, housing insecurity, and housing quality. Some constructs have one score, others break down into subscores. And we built this package to work smoothly inside the Of Us Research Workbench. That means it runs in both RStudio and Jupyter environments within the platform. And here's a snapshot of the constructs. This diagram shows how the 14 constructs are organized. For example, neighborhood disorder breaks into physical and social. And discrimination can be everyday or in healthcare settings. Housing insecurity includes both insecurity and number of moves. And each of these has their own scoring function in the package. And this diagram helps clarify what's available, kind of like a manual of what you can calculate. And as a reminder, all of this is designed to be used inside the secure Of Us workbench. so that you don't download or move the data. Instead, you work with it directly in the cloud environment provided by all of us. And we can talk more later about how to get involved, like how to sign up, access the Workbench, and use this rich data set to customize your own research. Now let's talk about how it works. So the functions follow a pretty simple workflow. Like you load the package in your SDOH survey data, which should include person ID, question concept ID, and answer concept ID. And then you call one of the scoring functions like calculate cohesion or calculate disorder. The function gives you back a tidy data set, one row per person with the score computed. It's really that straightforward, and let me show you what that looks like. So on the right side is an example of the input. It mimics the long format used in the All of Us platform. Like each row is a single answer from one person to one question. And on the bottom, you can see the result. A clean table with one row per person and a score. In this case, for neighborhood cohesion. So this is what makes it usable in downstream models, summaries, and visualizations. It's like no more wrangling for raw concept IDs. And if you compute multiple constructs, you can easily merge them all together. We provide code to combine all scores using either dplyr, full join function, or other choices, and you get one comprehensive dataset for your analysis. Here's a peek inside one of the scoring functions, calculate cohesion. So it pulls for neighborhood-related questions, maps the answers from strongly agree to strongly disagree, averages the responses, and returns a clean cohesion score for each person. So you don't need to write any of this, just call the function and everything else is handled for you. The package was released by Crane on March 26, and it's also on GitHub if you prefer the development version. The paper has also been submitted on May 13th. And we are also keeping it up to date as the All of Us platform evolves. So if like they change how questions are labeled or add new domains, we'll reflect that in the package. So why does this all matter? SDOH factors like where you live, how safe you feel, and whether you are socially supported strongly affect health outcomes. But for now, those variables have been hard to score and standardize, especially at scale. So with this package, we are helping make SDOH data easier to use, easier to share across studies, and easier to reproduce. So we hope it helps accelerate research on health equity, which is what all of us is really all about. And if you want to try it out, you can sign up as a registered All of Us researcher, access the survey data via the research workbench, and install the package from Crane or GitHub. And then you can apply our package to your research. We are always open to feedback, feature suggestions, or collaboration ideas. So we couldn't have built this without a lot of support. Big thanks to the All of Us team and participants, the authors of the scoring guide, the Crane and GitHub ecosystems, and thanks to the R Medicine team for the chance to share this work. These are the references I talked about today, including the program, survey, workbench, user guide, is in the slides and documentation. Thanks so much for listening. I'm happy to take questions or feel free to reach out by email if you'd like to connect later. Thank you.
Thank you so much for this really exciting package. I can see there's a lot of enthusiasm in chat. So I went ahead and added the link to the GitHub in chat. I think people would appreciate having your email address also in chat so they can copy it. Um, I'll ask if people do want to contribute to this package, what is your preference? Would you like for them to put an issue in GitHub, send you an email, do a pull request? What's your preference for people who would like to collaborate with you?
Yeah, I think like both way works for me. You can just email me for your responses, or like you have issues for this package, or you can just report on GitHub. I'm fine with either way. Yeah,
Excellent.
just let me know if there are any questions for that.
And we have time for just one last question. Ben asks in chat, how is missing, don't know, and prefer not to answer handled?
Yeah, so there are like some responses are treated as missing because the participants answer like they don't know or they prefer not to answer. They have these responses, so we are treating these as missing values, and the functions just automatically exclude them from scoring calculations. So like they will not affect the average of total scores.
Excellent. Thank you so much. This was
Thank you for
great.
listening. Thank
Have a great
you.
rest of your day.
You too. Thanks.